to appeal to the president. Because when he came to address the nation, he said that stay home. That's the best medicine that you can get. Stay home. And that's what we are doing. We are retired. This is a complex of retired people, who are very, who are at risk, So we're staying home, and then the health minister has decided to bring the COVID to our doorsteps, to our doorsteps. What is he trying to do?
Today marks exactly 6 days since the residents of the former Zambia Airways complex started the process of refusing the use of the former Victoria Hospital in their residential area to be used as an isolation center for patients with the coronavirus.
Our reaction is that the whole process, the way the government is doing this, is a bit disappointing. We're disappointed that the government is imposing decisions on us. The other day when the mayor of Lusaka came here to speak about the same issue, he told us that the government is not going to impose any decisions on us. So we thought that was the truth. But obviously that is not true, and the government wants to impose its decision on us. Now, the disappointing thing about this is that we actually wrote to government, to both the Permanent Secretary and the Minister of Health, expressing our objection to this process of screening and quarantining in this house. We were expecting a feedback from them, at the very least, respond to our communication. Nothing like that came back. Instead, what we had is an imposition on us. So the only conclusion we can take from that is that it's doubtful whether the government really cares about our situation here.
These men and women say they feel government is not concerned with their welfare. This time around, they don't want the Minister of Health, but they're calling on the President, His Excellency Edgar Lungu, to intervene in the matter as they feel unsafe. They have asked why can't government find isolated places and avoid using residential areas for anything that has to do with the coronavirus.
What really surprises me is that we have found out that this place here can only accommodate 9 beds. And if it can only accommodate 9 beds, why should they bring it here as a center when we have bigger places like Levi Manawasa Hospital, which can take up to 800 beds? And at the same time, why should they want to spread the disease everywhere, this coronavirus? Because already we have ibex here, which has also been identified.
This is the same coronavirus that has taken many lives across the globe. Constance Mwemba, reporting for MoH TV News, Lusaka.